Right. Hello, everyone. Hope everyone is having a really great day. I myself is Karismita Sasidran, name B04198016. And we have two more friends here. You can introduce yourself, guys.
Hi, my name is Nicholas Hanzengwei, NIM B04198011.
Hi guys, my name is Anjali, name B04198029. Nice to meet you all today.
Nice to meet you all. Okay, let's get straight to the point today. So we are discussing about pregnancy in cattle and also its complication. So I would like to ask both of you, do you have any comments on like what pregnancy in cattle is all about, the basics, the knowledge, anything?
Okay, so let's start off with the normal childbirth of cattle, which is Eutokia. Okay, so what is Eutokia? Eutokia is normal childbirth characterized by uterine contractions that result in progressive cervical dilation and fetal descent. In cattle, Eutokia is normal calving, which normally takes place without assistance. However, close observation is required in case that cow has difficulties. Cows calving for the first time, which is heifer, tend to have more problems than older cows. And therefore, it is very important to understand the normal calving process in order to determine when to intervene. So, calving is a continuous event, but for explanation, it is divided into 3 stages. The first stage of parturition is dilation of the cervix. The normal cervix is tightly closed right up until the cervical plug is completely dissolved. In stage 1, cervical dilation begins some 4 to 24 hours before the actual birth. During this time, the progesterone block is no longer present and the uterine muscle are becoming more sensitive to all factors that increase the rate and strength of contractions. At the beginning, the contractile forces primarily influence the relaxation of the cervix, but uterine muscle activity is still rather quiet. The cow may show signs of discomfort by kicking at the belly and becoming restless due to contractions. She may separate herself from the rest of the cows and urinate frequently. These signs are especially evident in heifers. Next, the second stage of parturition is defined as the delivery of the newborn. In this stage, that lasts 1 to 2 hours for cows and 2 to 4 hours for heifers, the cervix is fully dilated. The cow may lay down, contractions will increase, and abdominal pushing is obvious. It begins with the entrance of the membranes and fetus into the pelvic canal and ends with the delivery of cow. The calf must enter the birth canal in a certain position in order to have a normal delivery. The third stage of parturition is the shedding of placenta or fetal membranes. In cattle, this normally occurs in less than 8 to 12 hours. Administration of antibiotics usually will guard against infection and the placenta will slow out in 4 to 7 days. And that's it from me.
Right, very, very informative talk from Nicholas there. So next we are heading towards Anjali. Anjali, do you have any other comments regarding this gestation period or Eutokia or anything?
Thank you, Nicholas. That was an excellent explanation on how childbirth is happening in the cow. Now, I think I will talk more about the gestation period in cattle. Talking about the gestation period, it actually varies upon breed and the sex of calf, which is the baby inside the pregnant cow's womb. In general, gestation length, it's from 279 days to 287 days, approximately 9 months plus, just like us, humans. But for most breeds, the minimum gestation duration is 283 days. Besides that, cows carrying bull calves tend to have slightly longer gestation period compared to cows carrying heifers, like what Nicholas mentioned just now. So during this period of time, it's very important to take good care of pregnant cows. For instance, adequate amount of space must be provided for cows to stand, sit, and rest comfortably. Other than that, proper food diet, diet that consists of enough nutrients for the mother and the child, and enough water around the clock, approximately 75 to 80 liters. And during this gestation period, it is also very important for pregnant cows to be given bedding material, especially when nearing to the calving time. So around 4 to 5 days before the calving, the mother should be tied or left in a separate, clean and airy area that has enough sunlight access, with bedding materials like paddy straw should be spread on the ground. Finally, breeders and cow owners must always watch for patuation signs such as enlargement of udder, distended udder, depressed or hollow appearance on either side of the tail head, enlarged vulva, and also you can see thick mucus discharge and vulva from vulva. Other than that, the main sign that you can see is the cow moving here and there and having an uneasy feeling. This is where you know that it's going to give birth. So yeah, that's it about the gestation period. I hope you all learned about how this whole process happens.
Yep. Thank you, Anjali. That was really, really interesting. So talking about normal pregnancy, Eutokia and everything, there is also complication in pregnancy in cattle. So I'll be talking about the common complication, which is distokia. So what is distokia? Distokia is actually an inability to remove the neonates or like the fetus out from the uterus through the birth canal. So there are two main causes why this distokia is happening in cattle, especially. The first one would be heavy birth weight, and then the second one would be small pelvic area. So for the first one, heavy birth weight, there are three factors. Number one is gender. So according to some research that I actually read, bull calves are actually bigger than normal female calves. So when a cow is impregnated with a bull calf, I think it will have more complications. For the second factor, it would be nutrition level. Just like Anjali mentioned just now, you need a really, really good amount of nutrition, but not to give too much of protein, because if you give too much of protein, the calf might be growing bigger than the pelvic area, and it will cause more complication. And the third factor will be genetic influence. Well, we can't really comment on genetic influence, do we? Because it's just genetic. And the second one, second cause would be small pelvic area. Small pelvic area is normally because the poor condition of the cow and how we take care of the cow during the gestation period. Just like Anjali mentioned as well, you need a really good surrounding, really good nutrition, really, you have to keep on watching the cow, how it's behaving and everything to make sure it's actually ready for the delivery. Moving on to the clinical signs. There's not much mention about the clinical signs except for improper cervical dilation. So this is mainly what distokia is about. If the fetus is not coming out, then that is called distokia. So for the treatment, right, cattle have different treatment than small animals, because I think last week we did something about distokia in dogs. Compared to dogs, dogs do fetal extraction and C-section. In cattle, we do both of them, but there's another thing called fetotomy. So fetotomy is basically abortion. It only happens if the calf inside died. So basically we separate them into few compartments and then we remove slowly one by one to avoid complication to the mother. And second one would be forced extraction, fetal extraction. It's the withdrawal of fetus from birth canal. And we have to use really, really good amount of lubricant to allow the calf to come out easily without any complication. Because I read that if you like apply extra force, then the calf might get injury in the limbs or something. The mom even can die out of the pain. And the third one is C-section. I think there's nothing to explain about C-section. If you fail doing fetal extraction, then we move on to C-section. So yeah, that is all for distokia. And I would like to conclude today's topic. So my conclusion would be, I think more people need to know. As a veterinary student, we think that it is important to spread this knowledge to common people so that more people know about it and understand how this helps keeping the economy balanced. So do you guys have any conclusion to add?
Thank you, Karishmita. It was a very impressive discussion that we're having right now. So to conclude the whole discussion that we were having, calf losses at calving time are often a result of distokia, which is the difficult calving problem. So many of these losses occur to calf born to first calf heifers and can be prevented if the heifers and cows are watched closely and distokia problem detected and corrected early.
Right. Thank you, Nicholas. Anjali, do you have anything to add to conclude as well?
Hi guys. So in my opinion, we as veterinarians should handle this issue as a serious and complicated calving problem. Ranchers must be used good judgment in their decisions as to which problems will require professional help. In the earlier help is sought, the survival rate of both cow and calf. So what I'm trying to say from here is that we veterinarians must work hard to avoid any kind of death from either mother or child. That's all from me. I hope we have brought our listeners through a very interesting conversation, which is from normal pregnancy to how a pregnancy journey is, and also complications in cattle pregnancy. I hope you guys benefit a lot from this conversation.
Yep, Anjali, I agree with both of you, the conclusion that you made. So yeah, that's it for today, guys. I think we would finish off from here and we'll see you in the next podcast. Thank you and have a great day.
Thank you, everyone. Thank you.
Thank you, everyone. Thank you for listening.